Hello everyone, my name is Anastasia Kyvelidou and I'm an assistant professor in the Physical Therapy Department at Creighton University. Welcome to Virtual NASPA 2020. Today I will be presenting you the study titled Motor, Perceptual and Language Differences in Infants at High and Low Risk for Autism Spectrum Disorders. The incidence of autism spectrum disorders, or ASD, has increased dramatically in the last decade. The latest report from the Centers for Disease Control and Prevention states that 1 in 54 children are diagnosed with ASD, and it is 4 times more prevalent in boys than girls. It is also estimated that the economic burden of ASD for the United States by 2025 will be $461 billion if the current prevalence rates persist. Most children are still being diagnosed after the age of 4, though autism can be reliably diagnosed as early as age 2. Since early intervention affords the best opportunity to support healthy development, it is imperative to identify ASD as early as possible. One way of investigating prospectively symptoms of ASD within the first year is by examining infants at high risk for ASD. It is estimated that approximately 18.7% of ASD siblings may later develop ASD, while even a greater percentage may develop general motor, social, and communication deficits. In addition, ASD prevalence is increased in prematurely born infants, but the combination of low birth weight and premature birth yields greater occurrence of ASD. It is between 2 to 10%. However, this group of high-risk infants has received limited attention in terms of early signs of ASD. For this study, we were interested in a common tool, the Mullen Scales of Early Learning, which is used frequently in infants at high risk for ASD, and we wanted to determine whether it can detect differences among 3 groups of infants, 2 high-risk groups and a group at low risk for ASD. The Mullen Scales of Early Learning is a standardized assessment that is commonly used in clinical psychology as a developmental measure of cognitive development. The Mullen is organized into 5 subscales: the gross motor, fine motor, visual reception or nonverbal problem solving, receptive language and expressive language. An early learning composite score can be derived from fine motor, visual reception, receptive language and expressive language scales. For the present study, we were interested in performance of infants in each individual domain and not the early learning composite score. Here I am presenting you the data that we collected at the onset of seeding, which was for most infants between 5 and 6 months of age. And then we collect also the Mullen scales at 12 months of age. As you will see, the only statistically significant difference was in the visual reception score, and it was between the infants at low risk or with typical development, which you see in blue, and the infant siblings, which you see with the orange striped bar. Interestingly, the infant siblings of children with ASD presented the lowest scores in all domains. The group that was born prematurely and with low birth weight had higher scores in the receptive and expressive language among all other groups of infants, but that wasn't statistically significant. But you see an overall trend that the higher scores are in the low risk group, and then as you go to the premature and low birth weight, you see a little bit reduction in the scores and a further reduction in the high risk siblings. Now, which of these infants will go on to develop ASD? This is the interesting question, and this is what we are collecting right now. At 3 years of age, we are doing the ADOS, the Autism Diagnostic Observation Schedule, to determine which one of these infants might develop ASD, and then go back in time and look at the developmental trajectory, not just in the Mullen scales, but in several other measures that we are collecting. Thank you to all the infants and their families, and thank you for listening.